Now it is my great honor to introduce an incredible champion for healthcare, for human rights, for civil rights, somebody who has been in this fight on so many levels, somebody who, in spite of everything she has gone through recently, has only redoubled her commitment to this issue. I am so proud to have as my friend and my co-chair of the Medicare for All caucus, the incredible Debbie Dingell.
So good morning.
Good morning.
I'm really honored to be here with all of my colleagues who believe deeply in this issue and with so many organizations and people across the country. You know, we were planning this press conference several weeks ago, and I didn't think I'd be standing here today quite feeling like I do. John Dingell told me the day that he died that I was to bring this home and bring it over the finish line. And I am going to take every ounce of my being because I know that every American in this country has a right to quality, affordable health care, period. Yeah. You know, hard things don't happen overnight. His father was the author of one of the authors of Social Security, and all the things that you're hearing now were what was said about Social Security when it first passed. And now, nobody could think any senior or family member or friend or somebody that's a member of a community could think about somebody not having Social Security because people are entitled to have a decent, safe, secure retirement. Right. So after they finished that, because there were so many people in this country, and as you heard Pramila say, still don't have access to quality health care, the first universal health care bill was introduced in 1945. Yes, by somebody who happened to have the last name Dingell. But he never stopped working. And then when John Dingell got elected in 1955, this isn't about the Dingells, it's about somebody knowing what's got to get done and never stop fighting until you deliver it. Yeah. And it's time.
Preach.
So, it's 1965. It took 20 years to get Medicare because finally this country woke up and it saw that our seniors were living in poverty and were dying because they couldn't afford to go to the doctor and get medicine. We passed it, and people realized the conscience of America said, why didn't we do this before? Yeah, right. Then we started looking at our children. So many of them weren't getting prenatal care. They weren't getting the immunizations. They weren't able to. I still hear parents tell me that they didn't take their child to a doctor because they had a cold and they couldn't afford it and ended up having pneumonia. I still hear parents tell me that they've got a child who had something wrong and it's cancer and they needed help to even be able to get that treatment. But in 1997, we passed CHIP. Now, we haven't stopped. The Affordable Care Act was a step. But there are too many people in this country that do not have access to quality, affordable health care, period. And it's wrong. Yep. And the time for action is now. Yeah. It's time to act. Woo! We are the only industrialized nation in the world that does not ensure that everyone has health care. You want to talk economics? I'll talk economics with my Republican colleagues. It's a competitive issue because those countries aren't having to compete with what health care is costing employers today.
That's right.
It was one of the problems with the auto industry when some of them went bankrupt in 2008. But this is a moral issue. This is that we've got seniors. You know, I've lived at the doctor a lot the last 4 years. And I told my colleagues that taking John to the doctor, it was like going to a town hall meeting. I had to actually schedule more time. The mother of a juvenile diabetes daughter, who when they started talking about pre-existing conditions, stopped and said to me, I don't know if my daughter's going to live. I don't know if she's going to have a life. The seniors that I have met, you know, people think this is a talking point when you say seniors are choosing between insulin and food. come to Michigan, come to our districts. I'll take you to the places where these seniors are talking about it every single day. I've worked on breast cancer my whole career. I go into communities and I try to get women to get mammograms. And we've gotten the mammograms cost donated. But they're like, even if I get it, I can't afford the treatment. That's not who we are in America. And we have progressed to taking care of seniors and children. Isn't it time now that we make sure if you are in this country and you are sick, you've got a right to go to the doctor, afford your medicine, get the treatment you need, and maybe if we did more preventative care, we wouldn't have some of the costs. And when you, all right, I'm going to say a couple other things. People say, oh, this is just a messaging event. This is not a messaging event. We are going to get health care for every American.
Yes,
we will. And I will my colleagues and I, we will travel the country. We will meet with every single stakeholder. Everybody's got a perspective. Everybody's got an understanding. But I'll tell you, how are you going to pay for it? We're going to pay for it by eliminating all of this bureaucracy, all of the money that goes into paying the bills, and let doctors, instead of worrying about all that paperwork, treat the patients, and we're going to stop wasting money on bureaucracies and insurance companies. So, my friends, get ready. We are going to make this a reality for every American. Thank you very much.